So good afternoon. My senior project is about the benefits of physical activity on Parkinson's patients. So just as a refresher, Parkinson's is a neurological disease that affects movement. The symptoms typically start gradually and progressively deteriorate over time. And this is because dopamine production in the substantia nigra decreases. Parkinson's at this point is not curable, but it can be treated with medication and in some cases surgery. And there is evidence-based research that is centered around the benefits of physical activity in managing and decreasing the symptoms of Parkinson's. Research supports a variety of different exercise programs as part of Parkinson's treatment plans. So my first journal was entitled "The Effects of High Impact Training on Parkinson's Disease on Motor and Non-Motor Functions." So this study included 24 participants that were divided into two groups. They were basically just split in half. There was no randomization or no rhyme or reason to who got into what group. The study itself lasted 32 weeks and it focused on personalized training, and the intervention group trained twice per week with the option of a third day. Data was collected primarily using the Parkinson's Disease Rating Scale and the Parkinson's Disease Questionnaire, or the PDQ-39. The one drawback to the study is that while we know that the exercise or the physical activity was based on strength training and resistance training, it really didn't break down any specifics of what those activities were, or if one might be more beneficial than the other. So the study itself found that there was improvement in the UPDRS, but they didn't find that the questionnaire showed any improvement. The study itself thought the benefit of the longer length of the study and the personalized nature of the training could have been beneficial because of cognitive decline in Parkinson's doesn't happen in a linear fashion. It's nonlinear. So the ability to give the participants extra time to learn movements, to get additional cueing, additional demonstration of what the activities are, could have helped benefit the participants in terms of mastering the functions and getting the most out of each exercise. One question that arose was there wasn't a lot of flexibility improvement in the chest of the participants. So it was hypothesized that hypertrophy in the chest might have offset the benefits of the flexibility in the chest area. So basically they got the additional musculature in the chest decreased any improvement in flexibility. My evidence-based journal for number 2 was entitled "Predictors of Outcomes in Exercisers with Parkinson's Disease." It was a 2-year longitudinal cohort study. So again, study lasted 2 years. The average age was 66, 54% were male. Participants were pulled from existing exercise programs in the Indianapolis area. So the participants were tested 5 times over the course of the 2 years. They were required to take their medication before exercising to make sure that the meds were at their most effective when they were physically active. So the whole study was sort of based on an honor system. So the participants self-reported a rating of perceived exertion using the Borg scale, 6 to 20. And the exercise programs that the participants were already doing and doing most often. The researchers did take into account what stage of Parkinson's the patients were at, and they classified any comorbidities that the participants might have had coming into the study. So participants were required to do exercise logs of the exercises that they did most often. So one drawback of this study was that the participants were already active, and anything they did outside their common routine wasn't recorded or accounted for. So if a participant went hiking one day, they wouldn't have logged in the hike, and that wasn't a part of the research. So the data collected included the ICF, domains of body function impairment, comfortable 10-meter walk test, functional reach test, activity-specific balance confidence scale, and participation. So again, this one used the Parkinson's disease questionnaire, number 39. So the study itself did find correlations between ratings of perceived exertion and the ability to maintain the participants' level of function over that 2-year period. So on average, the rating of perceived exertion was 13.6, and participants exercised on average 220 minutes a week, which is actually quite good, quite a lot. And there was a direct correlation found between rating of perceived exertion and better testing times. So the strength of the study was that it took place over a long period of time, and it accounted for different scenarios that would impact the test outcomes. Patients actually used whatever exercises they preferred and what they were already doing. And those benefits, so the exercises themselves didn't correlate to how well the outcome was. They just took the exercise mode, had the participants generalize what their rating of perceived exertion was, and they made correlations to how that interacted with the outcome of the testing. So the weakness of this particular study is it didn't really take into account any one exercise regime. So we couldn't really figure out if more cardio, more strength, more flexibility balance was more beneficial than what a different, makeup of another scenario. It was just whatever happened that the participants happened to be doing. And the study also pulled from groups that were already active. So it didn't really address how you needed to motivate a patient or a learning curve that we saw in the first group, where the more personalized training sort of could account for a learning curve of different movements. The study did find that early stages performed better, and younger patients also performed better. And as we learned in class, that a new diagnosis of Parkinson's often comes with apathy and depression, or both. And we have to sort of account, this study didn't really account again for how you would overcome someone who didn't have a physical activity background. So you have to work through the apathy, the depression, and you still want to get them motivated as soon as possible, because the study found that the sooner you get active, the better your overall outcome. So my evidence-based journal 3 was the use of commercially available games for combined physical and cognitive challenge during exercise for individuals with Parkinson's disease. So this is a case series report. So this study used what they called an enriched environment. So just so you know, the enriched environments are complex, physically and cognitively engaging, and provided multimodal feedback, including visual, auditory, and somatosensory. So it has been found that exercising in an enriched environment can combat depression, which is possibly due to the effects of released neurotrophic factors. So the study was made up of 3 separate participants. All of them had a mild to moderate Parkinson's. It was a quick study. It only lasted 3 weeks. There were 6 sessions, which were done twice per day. So to create the enriched environment, the study used a virtual reality Xbox 360. 7 games were selected specifically to address deficits that were found in Parkinson's. In addition to the enriched environment, all the patients had a walking regime and were on stable medication. Data collected was balance, reflex responses, and speed of movement, cognitive engagement, and multitasking. So the game's difficulty was adjusted throughout the study, and the rating of perceived exertion was documented. And the patients were again tested while they were at their maximum benefits for their medication. So they were tested on the functional reach test, a 6-minute walk test, gait speed, single leg stance, and the results were 2 of the 3 increased functional reach test, 1 increased on their 6-minute walk test, and all showed improvement with gait speed, which is actually pretty impressive when you take into account that it was only 3 weeks. So some of the strengths of the study was that the games can be selected to focus on specific deficits. The participants themselves thought the games could be fun. They thought they could do them with family. And the fact that it was a Xbox 360, which could be used at home, was also seen as a big benefit. The research itself didn't really compare how virtual reality or an enriched environment would compare to traditional exercise. Given that, we certainly saw improvement. And ultimately, what I thought was if you enjoy doing the exercise, you'll continue doing the exercise. And having an enjoyable exercise regime that can be done indoors certainly has benefits for those of us living in Maine coming up onto our winter season. So my references and my final thoughts. So my final thoughts, all 3 of the researchers that I looked at did find correlation between ratings of perceived exertion and the benefits that would come from exercising at a higher rate of perceived exertion. So it's important for us as we go into the physical therapy world to keep in mind that we have to challenge people and not sit back and think because they have this disease or because they are elderly that we need to take it easy on them. We really do have to make them work, engage both mentally and physically, and really make sure that they are sweating a little bit, breathing a little hard, and really that will be needed if they're going to actually show progression, slow down the progression, or show improvement with their Parkinson's symptoms. The other part of that, or the flip side of that theory, is when I did my interview for neurology, I did interview a gentleman that had Parkinson's, but he also had a lot of comorbidities. He had to have radiation. He also had some pretty severe arthritis in his back that produced some scoliosis. And I think it's important that actually do relate a lot of his physical activity. He was involved in a lot of different programs and continues to be in a lot of different programs, but the level of activity that he is able to do is actually probably less than would be most beneficial. So it is challenging to think of how do you find that sweet spot of making sure people are working hard, but not doing any additional damage to things that they already have going on, or how do you keep them from regressing when they have to take an extended period off because of fatigue or problems that might be associated with chemotherapy. So coming up with individualized regimens that will match and be capable of doing for each patient and participant is going to be super important going forward. So I think my final thought was that you really have to treat everyone as an individual, know what they're capable of, and encourage them to get active soon, which is better than later, and really make them do the toughest exercise regime that they are capable of doing. And I thank you for listening. I hope everyone does well on their finals.